Well, good afternoon, everyone. We'll get started here in about a minute or so. Give folks a minute or so to get logged in, and we'll be starting shortly. Okay, we're going to give folks just about another 30 seconds and we'll get started.
So we have a full agenda today.
We do. Okay, well, let's go ahead and get started. Elizabeth, I think I'm kicking this off for a few seconds, right?
Yes, and going through the training slides.
Okay, that's what I thought. Well, welcome everyone. I'm Steve Modernock. I'm Executive Director with the Executive Director with the Association of Food and Drug Officials. Well, I was going to change my title there for a second. We're excited to have you all with us today on this very, very important topic that we're going to be talking about with risk factor studies, which is extremely important in the retail food protection program for maintaining and developing a program that really is focused on those public health-centric metrics. So let's go ahead and move on to the first slide. I'm going to do a couple introductory slides. I just wanted to remind everyone that don't forget that if you do need any of the FDA trainings, you can sign up and register for those. There is a link to all of them on the AFTO site. These currently are all the courses offered through September 30, 2022, and coming up normally in July, end of July, early August, the courses for the next federal fiscal year will be announced. So please go ahead and do that. Next slide. In addition, if anyone is interested in an environmental sampling course for retail foodborne outbreaks, please let us know. We do have a few courses that are in progress right now across the country, but we can add more. These courses typically are brought to you with no cost for the course. Your cost would be bringing the people to attend. So those are available. It is particularly if you're thinking about adding environmental sampling to your foodborne illness program, your investigation program. These are a great opportunity to teach your core foodborne illness investigators on how to do environmental sampling and when to do environmental sampling, all based upon the CDC NEARS work and that general process for environmental assessments. Moving on to the next slide, we do want to note that if you are a state that does allow for wild mushrooms, there is some new guidance out there with lots of photos that could be helpful to you all as you face that challenge of is this mushroom indeed edible, edible, and et cetera. So please take a look at that if you haven't seen it. Thank you, Sarah. I'm glad to hear
it. Yes, it is very good.
I'm glad to hear that. Let's move on to the next slide. I do want to welcome and encourage all of you to consider attending the AFTO 126th Annual Educational Conference. For those of you that might have a few extra minutes afterwards, I think Amy is going to play a little introductory video about what to expect at the conference, but it is going to be a great event. I can tell you we are already at 20% of the capacity as of right now. So I would urge you to take advantage of that early bird discount, which has been extended to April 15th, and get your registrations in. It is definitely going to be a full house from all early registrations thus far. Let's move on to the next slide, Amy. Lastly, or near lastly, don't forget if there are a few seats left in the April and a few seats left in the May courses for root cause analysis for retail food safety. Having read through the course evaluations, words such as "this is the single best food safety course I've ever taken" are not uncommon amongst those that evaluate the course. So I do encourage you all to take it. There is a cost associated with that. I can tell you that we're subsidizing about 33% of the cost from AFTO general funds for each person to take it. It's not actually even covering the whole cost of it, but it's a pretty amazing course. And thank you to Elizabeth and the others that participated in the development of that. But it is definitely a great course, and we're seeing phenomenal feedback from the participants. So if you haven't had an opportunity to take that, please do, or please think about it. It's a great opportunity. And after May, we will be on break for through the summer and come back with 3 courses in the fall and early winter. So just a heads up, and it is a very, very small group virtual session, great opportunity. And if I remember right, it's limited to, I believe, 18 students. So when I say small group, it is very, very small, purposely so that we can have that highly interactive work in the course. Moving on to the next slide. We just wanted to mention there's some work that will be coming out in the summer of 2022. We will be working to pull together a handful of program standards working groups for state programs, really focused on the type of state you're in. So recognizing that there's a whole lot of ability to beg, borrow, and steal between those programs that are alike, we are going to bring together these small groups. And if anyone has a better set of groups, these are the 3 core groups that we think we will start with, but we may add additional as we go forward. So we're going to do our best to figure out where you'll fall and invite you all to the right groups going as we get into the summer, but that is coming soon. So just wanted to have that on the preview for you all. And if anyone has some additional ones you think should be on that list, we would be happy to add those, but those are the 3 that we're going to start with: home rule, delegation, and statewide programs that do not have local agencies. So from that, I believe if we go to the next slide, we move to Elizabeth for this next slide.
Just wanted to remind you all, we will repeat these dates at the end of the presentation, but our next call is May 4th. At this point, we're going to be talking about HACCP review at retail. And then our next 2 calls, again, taking a break for the summer holiday season, a vacation season, but back in September, December, and probably I might be soliciting some topics from you all. So be thinking about what future topics you would want to have presented. So next slide, Amy, I think is we're going to be welcoming Mr. Andre Pierce. You know, Andre was recently hired on and promoted to the Office of State Cooperative Programs Retail Food Protection Division Director. Welcome, Andre. We're so excited to have you on the call. Andre is going to just give a real brief, I would suppose, FDA perspective of the risk factor studies that are required with the program standards. So there you go, Andrew.
Yes, thank you very much for having me. Thank you for the introduction.
And Andre.
That's all right.
Andrew.
First of all, I want to thank you all for coming, for your interest in this wonderful forum. It's an opportunity to learn and share. I particularly like the title about taking one bite at a time, because that's kind of the way we did it in my experience. So I think it's a great opportunity and forum. Also, thanks to AFTO. This is a forum, and we'll talk a little bit about this in my presentation. This is sort of a mentorship type of model here, where others are present, and you'll be able to see others who are here and reach out to each other to find the challenges they've had to study and things that have gone well for them. And last, thank you for having me. I'm new. I've not been there 3 months yet, but I'm learning a lot in this new role, and I'm very excited about being on the other side of things and trying to think about how we can support it. So for me, and I'm going to talk about my experience with it. I'll talk about the FDA's as well. But for me, in a public sector, we can't measure things in terms of the bottom line, the money. We have to do program evaluation. And the risk factor study, to me, is an out-of-the-box solution, really to build the backbone of a program. So it is real exciting to me to think about how we can use this study, this really nicely collected, very valid, replicable data, to create interventions to address other concerns in our programs. So this is a perfect forum for launching the program standards and for really seeking quality. it's really, for me, an essential part of developing that public health metric. So really getting the quality data is out there. I would like you to drop in the chat, as you think, as I've introduced a couple topics, I'd like you to drop in the chat, which I can't see, the linkages you see between the risk factor study and the other standards. So I challenge you to think about that now, because that's really where this launches, right? The risk factor study launches off interventions, and it also launches and prompts us to think about other standards and how we can improve programming. So I'll just mention a couple to whet our thoughts a little bit. Think about standard 1. In my experience, standard 1 in my area, we identified lots of gaps in our policy. And one of the objectives in the collaborative association, of which APCO is involved, is the food code adoption. So naturally, when we did our study, in my experience, we identified a lot of items in there. One simple one to say is we didn't have a bare hand contact rule. So that was one thing that identified. So we actually used that to promote policy there. Also consider the ways that the risk factor study can play into standard 7. Think about the information you get from the study and how you can take it back and vet it with the managers, who are all of our customers. The kitchen worker is our customer, and ultimately the diner. How do you take this information and get it in a form they understand? Not the way the government understands it, but a way they can affect public health and serve it up every day. So I will launch into this conversation by saying something that I've heard Frank Giannis say it in this way. You get what you measure gets managed, is what he said. My way of always having said this is you get what you measure. So if you have a program, and in my program, in your program, if you say people, you're going to get 8 inspections a day, you're going to get that. That's goal displacement. People are going to focus on that. But when you decide as an agency that you're really interested in making a difference, and you start conversations around risk factors, interventions, and making a difference, it changes the tenor of your conversation in your program. It changes it from processes to outcomes. So thanks again for coming. And if we can go to the next slide. So this is just an overview. And we all know that a risk factor study is a collection of data over a distinct period of time to show how certain food safety practices are done, either properly or improperly. And during a study, you can observe what's happening. We can't know really how well a program is doing in terms of foodborne illness in a community, right? Because there's so many factors at play, but we can observe risk factors. We can know what they are and observe them. So in the studies, a single survey, in the FDA study, which we're going to show the timeline in a minute, a single capture of the data is a baseline of where you are. So in the FDA study, the first study that we'll talk about is in 1998. That gives you the baseline. A study, though, is generally 3 data collection points. So it gives you a trend over time. So when we're looking at that history slide a couple from now, just keep that in mind. You need to be checking out, get a snapshot of where we are today, look where we are next. So that's where we are. So we'll go ahead and go to the next slide. So I can't really go do a risk factor discussion here without bringing up the CDC contributing risk factors. Here they are. I'm not going to read them so word for word, but hygiene, holding temperatures, contamination, contaminated equipment, inadequate cooking, and food from unsafe sources. So as I was writing this down, and I've always thought this, if you have a new person who comes to your staff and you take that person out with a risk factor study instrument, just as a training tool for a day or two, and you do a couple of these, think about how that can change the culture, change the experience that person has when they come in. And we always talk about changing the culture, getting away from a cracked tile, or a dirty surface, a dumpster lid. I mean, you know how a lot of our staff will focus. I mean, I remember when I went out first time, that's the things that we thought about. But changing it to this, and this should roll off of all of our tongues, in my opinion. So these are the questions that are going to back up what a study is going to include. It's got to include these. And also you can add other questions such as, the public health interventions. So, one public health intervention, as you look at that slide there, inadequate cooking, is consumer advisory. So the others are bare hand contact, demonstration of knowledge, employee health controls, and time temperature relations, such as date marking. So those are items that are typically in a study, and they were, in my experience, they were in the study that we did. Also, as you have a paper, I don't want to steal your thunder, Elizabeth.
That's okay.
You have a document that I think you're going to be providing.
Yes, and it's maybe segue into that so they can be looking at it if they want, but there's a link in the chat at the top.
Perfect.
Mm-hmm.
That gives somebody, yeah. So it's going to tell you, you know, you need to have in, your survey instrument needs to have in, out, NA, NO. So that's just all I want to say about that. From my experience in the jurisdiction I was in, from our first to our second study, there was improvement in a number of areas. And as again, think about how those relate to other program areas, other program standards areas. At the time, we could not do anything in my jurisdiction because the state controlled our rules. So we worked on standard 7. So, but think about the risk factor study guiding what you do in your program and the other linkages. Can we go to the next slide? This gives the next one gives just a little history, and this is real detailed, and it's not, you don't have to memorize this. That bottom link down there, Amy, I can't see the chat. If you could, I sent you an email. If you could drop that first link in there. This gives just basically two of the studies that FDA has done. So the top one were the studies. Yeah, thanks. The top one were the studies from 1998 to the collection from 1998 to 2008. And so we got the baseline there, the 2003 data collection and the 2008 data collection. This was of the 9 segments. These are not the 3 segments, the 9 types. This study was really intended just to be the what. This was just saying what's out of play, what's out of order, and how it progressed through time. And in that study, FDA found that we still had some major issues with holding, personal hygiene, and contamination. We did, I'm gonna give just a real snapshot. We saw that bare hand contact really came into compliance over that period of time. The current study is in that second group of bullets, really is getting at the why. Let me get one back to say that in the first study, the what, we did make an association at that study between certified food protection manager, which came in we saw a relationship between those things, and which has come into food code. Now we'll go to the why. The second group of studies there, the second collections, are looking at what contributes to getting that information into the kitchen, food safety management systems, maybe, that kind of thing. So we're currently at our second retail food store deli collection. And in the future, we'll be doing the restaurant and one more for the retail food stores. We go to the next slide. This is my experience with it, and I hope that this slide's basically promoting it. I'm basically promoting it. So this is my experience with the risk factor study. In 2008, as I said, I think I've got about 4 minutes, don't I, Elizabeth? In 2008, we enrolled in the standards at the encouragement of our retail food specialist, which is a huge resource we'll talk about later. There wasn't any money at the time, but we enrolled and we could only meet standard 7. Everything else was controlled by the state. So we couldn't control the inspection sheet or anything else, the rules either. So we did our study. We talked to our specialist and I said, we really can't do much else. Our self-assessment was way off. And she said to us, and it was really divine. She said, do a risk factor study. Do it early. Find out what your baseline is. And as I said, it was divine because later we used the gaps. We got the letters to the state from our board. The Supervisors Association wrote letters. The Restaurant Lodging Association wrote letters. And the code changed before we did our second study. Now that's, Elizabeth, you'll know when I say this, who said it. It's like shooting fish in a barrel. You'll know who said that. So in our 2015 study, we showed a significant improvement after having new rules. So rules foundation is an intervention, okay? The last study we did last year, it was delayed. And this was funded through money, through FDA, through AFDO, thank you. We finished that study last year. It was delayed because of COVID. But just a little bit about the history. There's so much value in the study. We used the first study to reach out to the media, which we had a really good relationship with. And we got a front spot on WRAL. And we also made the front page of the second fold of the newspaper. So getting the message out to the community was really good, because I feel like someone's going to tell your story if you don't. So that was a good opportunity for us. So we did the studies, and so what? I'm going to flip over to the next slide. So what do you do with it? And I'm going to use this next intervention to just illustrate at a really simple level what we did with this. So in our study last year, we had a new rule we were comparing against the new code. And one of the questions on that study is the percent compliance, have knowledge about food allergens. And in our county, only 14% of those operators really had adequate knowledge of the question that we asked for the study. So thinking back to the things I asked you to put in the chat a while ago, taking that data, we took it to our Food Service Advisory Committee. First we did a survey. So we had observational data. Then we sent a survey out to our operators to ask them what they perceived was the problem. We took the combination of data to the Food Service Advisory Committee, and they provided us some really good information. They want pictures. People want pictures. They want short information. They wanted a large poster. They didn't want an 8.5 by 11 that gets laid on a desk, they said. They wanted a large poster. English and Spanish. We asked what languages. And then last of all, they wanted something for the customer to get the information back to the kitchen. So we did not reinvent the wheel on this. This is from FAIR, and it's available to everyone. This is a chef card that consumers can print off and carry with them to a kitchen in any language. Well, there's about 10 languages that they've done. So it took the liability from my county for creating this. So I use this intervention just to say, this is kind of how we use the study. This is how we blended that in with the other standards to get a product and now the rule has changed in North Carolina. We just adopted the code, the newest code in October. So again, we will see, I feel like we'll definitely see an improvement in this. And also there's a campaign for our inspectors speaking to our operators, and also it's on YouTube and the TV. So we'll go ahead and flip to the next slide. I'm not going to read this. I'm assuming you're going to get this. So there you go. And this is right off the website. It's also in the handout that Elizabeth is going to post. So these are the benefits, so many benefits of this. It's near and dear to my heart. It really is important to find out, you get what you measure. So to measure twice and cut once, right? You really want to do it right. You really want to be sure the data goes in correctly. We'll go to the next slide. Resource. Drop these last two links in if you don't mind. I appreciate it. These are the resources I wanted to share with you. First of all, I can't overemphasize the value that Donna Wanucha had for us when we started our study. She provided a lot of resource for us. So your retail specialist is a really good resource for you. The second thing there that I'll mention is mentorship. The NACHO mentorship program is a really good opportunity to get in there, get with other mentors. Steve, I think you mentioned the other groups that could get together. Like there's a network of folks in our state that work together to mentorship, to ask questions in a safe space where you don't feel like an idiot asking them sometimes. And then the last thing, and this I've not learned that much about, but the Food Shield site. And after you explaining a little bit of that later, I think, about that resource. So that's for a county or for a jurisdiction that hasn't done it, that's a great resource for you. So yes, I think I'm done. On time, Elizabeth. Thank you very much for the opportunity to come.
Thank you, Andre.
Look forward to hearing the rest of your meeting. Thank you.
Yes. So before we get started introducing our panelists, I do want to make a couple comments. When you all get this invitation for this call, feel free to, if you all can't make the call, we're really looking more for the state food program managers, but if there's any of your team that can join the call in place, if you can't make it, we encourage that you share the call so they can get the information as well. Other thing I wanted to let you know about it, when you log off of this call at the very end, before you go away, if you have time, there's a very brief, very short survey that'll pop up once you leave the meeting. I think it's like 3 or 4 questions only, just to kind of give us an idea of what, if we're meeting your needs and that kind of thing. So I would appreciate if y'all would take that survey when the call ends, when the meeting ends. The other thing, I kind of think this is a little bit timely. I was reading through some of my state survey data that I conducted last winter. And many of the agencies that have done risk factor studies, which there was quite a few actually, but they're really all coming due 2022, 2023. So hopefully this webinar will inspire you to start taking a look at doing your next study. As Andre said, some of these were just baselines. Now you have to kind of move forward to see if your interventions took effect, or like Andre mentioned, a food code that took effect, an updated food code took effect to reduce some of these risk factors. So I just wanted to remind you about that. And if you do have any questions, you can put them in the chat and we'll try to get to them, but we're trying to expedite this along, so there is some time at the end of the call for additional questions if you'd like. So I'm going to have each one of the speakers do a brief introduction, kind of their name and their association, and a little bit about their demographics, the how many people they serve, their number of facilities they inspect, things of that nature. So Morgan, would you like to go first since you're on top of the list?
Sure, I'd be happy to. So it's good to be on the call. My name is Morgan Louder. I'm an environmental health manager with the South Carolina Department of Health and Environmental Control. Before I was in my current position, I was a retail food standards coordinator for DHEC, and I led the process of conducting our jurisdiction's risk factor study. We've also mentored several jurisdictions. Last year, we mentored Pennsylvania Department of Agriculture as they did their risk factor study. And this year, we're helping out Tyler County, Texas. In South Carolina, there is about, or at least at the time of our risk factor study, there was about 20,000 retail food facilities. We had about 80 field staff at the time, and we've pretty much maintained that number today. And about 15 of them did a data collection.
Very good. Thank you, Morgan. Adam, do you want to go next? You probably don't need an introduction, but we're going to do it anyway.
Well, hello, everybody. My name is Adam Inman. I'm the Assistant Program Manager for Food Safety and Lodging at the Kansas Department of Agriculture. And we are the 34th largest state in population at about 2.9 million at the last census, and 15th in land area. So our people are spread out a couple of metropolitan areas that concentrate a lot of the population, and then a lot of rural areas. And covering that area, we have 52 field staff, and that's 45 inspectors and 7 district managers. They're the frontline supervisors. And across the state, we have, I just checked it a few minutes ago, see what currently, we have 15,379 food establishments. So those retail, schools, we cover everything except for assisted living and hospitals and prisons. We'll assist with those as asked, but yeah, we cover about everything else at retail. We are all state inspectors across the state. We don't have any local agencies that we work with for inspection purposes. So did a risk factor study, and happy to just answer any questions, and good to be here with everyone today.
Thank you, Adam. And Jeff Ludeman, would you care to go next, please?
Yeah, thank you, and good afternoon, everybody. Jeff Ludeman, I am the Retail Food Program Manager with the Minnesota Department of Agriculture. So in Minnesota, retail is split among 2 state agencies, Department of Agriculture and Department of Health. At Department of Agriculture, we license and inspect the retail food stores. So we have currently just over 7,600 establishments that are retail. We delegate to 7 local agencies. And so about 21% of those food establishments are within the delegated agencies' territories. Within the state of Minnesota, the population here is just over 5.7 million. And within the of that, I'd say about 23% of the population reside within the delegated agency jurisdictions. And so for the statewide program that I manage here, the Department of Agriculture. We have 34 staff within the retail program. Myself as manager, 5 supervisors, 22 field inspectors, and then the remainder working within construction plan review and HACCP plan review. So I'm happy to be a part of the panel today. Thank you very much. Just look forward to answering questions as well.
Great.
Thank you.
Thank you, Jeff. And last but not least, Miss Kathy Feeney from Rhode Island.
Thank you, Liz. Hi, so I'm Kathy Feeney. I'm the chief of the Center for Food Protection at the Rhode Island Department of Health. In Rhode Island, we have a very centralized system where we just have one Department of Health. So the Center for Food Protection is responsible for all food in Rhode Island. And the only thing that we don't do is produce, and that's over at the Division of Agriculture. But otherwise, we do retail food, manufactured food, we do dairy, shellfish, you name it. Anybody who serves or sells food to the public in Rhode Island is under our jurisdiction. We actually, for a small state, we're tiny, as you all know, but we have 1.1 to 1.2 million people. So it's pretty dense. And at this time, we have 12 inspectors. Usually we go from 12 to 15, back and forth, depends. Right now we have a few vacancies we're trying to fill. So, so right now we're a little bit lower than we usually are, but we have 7,200 retail establishments, and that includes restaurants, fast food operations, food trucks, temporary event food places, supermarkets, pretty much anything that would fall under retail where you're selling directly to the consumer. We're also mentoring a state, and I see Sarah Robbins on the call, and so we're mentoring Montana.
Nice.
It's been great so far.
Very good. Thank you all very much. Amy, do you want to go to the next slide and we go ahead and get started with our questions for the panelists? And I'm going to kind of rotate so we can get all the questions answered. But if any of the panelists have something in particular they want to interject, just feel free to do that. But as the title of the presentation says, you know, how do you do a risk factor study one bite at a time? I was over a pretty large metropolitan local health department. And I can tell you, this was many years ago, first read about risk factor studies, it just seemed very overwhelming to me. We did do one, but, and I will tell you that the tools and the mentorships that you all are afforded now were not available for my agency back then. So I think more and more the tools and the mentorships are going to be helping people to achieve this particular goal. But so again, I'll start with you, Morgan. You know, what initial first steps did you take to kind of gear up for this?
Sure. So one thing I'll say is that really these first steps, in my opinion, were some of the hardest aspect of the risk factor study. Once you get the ball rolling, things tend to go a lot easier, especially if the preliminary stuff was done effectively. So some of those preliminary things that we had to deal with was determining, do we want to use our routine inspection data, or do we want to do an independent data collection? There were people within the division that were on both sides of that divide. I pushed really hard for an independent data collection because I wanted us to use a data collection form that was similar to what the FDA used. We eventually came to a compromise where, yeah, we would do a independent data collection, but we would also try to get an additional inspector in to conduct a routine alongside the independent data collection. So part of this preliminary process is probably going to involve some compromises with different, perspectives on your team. Another challenge that we had initially was whenever we were sampling our industry segments, we wanted to pull or separate fast food from full service restaurants. But in our database, we just combined them together as restaurants. So it was actually a fairly grueling process that I had to take alongside a lot of our team leads across the state to identify manually which restaurants would be considered fast food or not fast food. And once we did that, we were able to sample them separate from full service restaurants.
Right.
Now, for other jurisdictions, you may have an easier process if you already have them separated. But one thing that I would encourage, like during these preliminary phase, whenever you're deciding what industry segments, you should think about what your database actually treats as each individual industry segment.
Good points. So Jeff, do you have any advice for the audience on maybe some of your first steps that you took?
Yeah, thank you, Elizabeth. Yeah, so team, one of the things we did, I had a couple of supervisors and I and a project coordinator. We got together, formed a work group, and penciled out a written procedure on this that include, some of the elements that Morgan spoke to. That is basically, what will we use, the FDA methods, that part of it. Also to look at plan for staff training, how you train the staff. Will this be done? How will we carry this out? What period of time will we collect data? Will it be done in conjunction with routine inspections? Things of that nature, and capture some of the methods as well on that, and how we would select facilities from our inventory, how many, et cetera, and that we would, at that had referred to the FDA's document published back in 2003 for that. Very, very helpful document. And the nice thing about it is capturing this in a written procedure is now, I can come back, we look at it now, 3-4 years later and know very well there were lessons learned along the way. I mean, it's a good plan, but plans change, things happen. And procedurally, then we can come back and review, make some changes, and improve the process the next time. Be reminded of how we did things and improve the process later. So very, very helpful. I think we found to kind of upfront take the time to plan for it, like a project plan, and get a procedure written for it. Thank you.
Very good. So Morgan, you mentioned a little bit that you decided, and Jeff too, about whether you're going to use routine inspections or special study inspections. So Kathy, I'd like to ask you, what did Rhode Island do in that regard, and why? And you can see from the slide there, how did it tap into those resources for you to on the methodology that you selected?
Okay, so for starters, I have to say we did procrastinate because it seems daunting at first, so we put it off. So when we finally decided to do it, it was around 2017. And I remember talking to Chief of the Center for Food Protection at the time, and he wasn't all that enthusiastic about dedicating staff to doing just that. It would probably have to be part of a regulatory inspection. So we really didn't get the buy-in. So we have the digital health department, it's now Tyler Technologies. So we have a lot of data, and we started using that in 2008. So what we decided to do was use our data, and that way we could at least look at 3 different points. The other problem for us is, we have a very low to establishment ratio, low inspector to establishment ratio. So we really didn't have enough staff to begin with, and we were constantly just putting out fires. So we really couldn't dedicate staff. So that's why we decided to use the data. And we were lucky because we have our data set up with secondary license types. So it's really easy for us to pull all the different types of licenses. For instance, for the schools, we have it set up so that we know who's the commissary, who's an in-feed, and who's a satellite. So that made it really easy for us to look at the data. So we decided to pick 3 different data points, and we did it 4 years apart.
Very good. So Adam, what did you do in that regard as far as routine or special study, and how did it impact your resources?
Yeah, so the first step is to admit that you need a risk factor study.
Yeah.
Have to go through the rest of the steps. I think it's important to be intentional about your decision, and I think it was alluded to earlier by everyone, is look at where you sit and the resources, and then there's different approaches to it as well. And now all of them have challenges and benefits. So for us, we felt that the benefit of already having the data in place, like similar to Rhode Island in USA Food Safety, and then also having the advantage of one of our consortium states with USA Food Safety, Iowa, had built a data dashboard that was based on doing a risk factor study from inspectional data. So that also nudged us in that direction. Trying to look at it maybe a little creatively, but just saying, recognizing it's not going to be perfect, but you need to take it on, is that having that existing data pool and data set to look at, like Kathy said, you can actually kind of do it ongoing basis. You can overlay, look in the past. Once you design it and develop it and figure out some of those kinks, that gives you some ability to see those trends that were hidden in there, and now you can get them out and look at that. So we thought that was powerful. We also did sort of just basically as part of our own exercise, a retroactive study. So you could look back and say, well, here's something that we did change at this point. Did that have any impact? So you might be able to mine some knowledge from the past. So just that intentionality about it, seeing what fits for your jurisdiction, and making that first effort. You got to have a version 1, and then you learn from it. And just like the spaghetti tower, you adapt it and try to make it better the next time.
Very good. So Morgan, refresh me. Did you all use the special study and routine at the same time? Is that how you did it, Morgan?
So for our data collection, we used our independent study data. The compromise that we ended up going with was whenever we would send an inspector to do one of these data collections, we would also send an additional inspector to do a routine. So that facility, even though they were getting a data collection, they were also getting a routine done at the same time. So that really helped to satisfy those that wanted to make sure that the data collection did not disrupt normal, routine inspection procedures.
Very good. Thank you. Okay, so some of y'all touched on this just a little bit, but maybe a little bit more elaboration. I'll let you speak to this, Morgan. Did you have to make, you can go to the next slide too, Amy. Did you have to make some changes to your software or data collection tools before you started the project?
Yes. So since we ended up going with the data collection, we had to create a unique data collection form that mirrored the FDA's data collection form. Basically, what we did is we just we made while theirs was more of a paper form, we turned it into one that could be completed on our inspectors' devices, just so they could more easily, submit it to us. We also ended up using the Food Shield risk factor study data entry site. I believe that's in one of the documents that was linked in the chat, or at least a link to it is in one of those documents. That was extremely helpful for us because not only did it provide us with a database that we could just enter data into without us having to create our own, it also helped to catch errors that an inspector could have potentially made during an inspection, because it wouldn't allow you to actually submit a data collection if there was an inconsistency. So that helped us to identify where those inconsistencies were, and then verify with the inspector what was going on. Do we need to scrap this inspection? And if not, help us figure out why this inconsistency manifested.
So Adam, did you all have to do any data manipulation when you started the study at all, or purchase any additional equipment or anything of that nature?
No, we using our inspection report is based on the annex from the model food code. So it did line up pretty well with that. Probably the trickier part, similar to what Morgan was describing, was we have all these subcategories listed out, but then because I am a splitter, we had to re-lump some things back together to get the larger groupings that we needed. So that was probably more the manually intensive part. That was probably the biggest change. But another thing with the procedures, one of the trade-offs is that using the existing data, as your program policies and procedures update, that's going to be a variability that you may need to account for. But at least we, have that, like Jeff mentioned, the approach is written out, and then there will be some variation based on the policies, but it seems to be working for us so far.
Okay, very good. Okay, so I'll start with you, Jeff. Can you tell us, first refresh my memory, what year did you do your risk factor study, Jeff?
We started collecting data in the summer of 2018 and then collected it over a 1-year period.
Okay. So you have your study findings. What did you find most enlightening?
Well, I could share my screen real quick if that would work. I have a PowerPoint. I could just quickly share some results.
Amy, can you? Does he just need to click the share screen button?
I don't have to. I could just.
Oh, no, it's fine. I think we have some time. Yeah, you can share your screen, Jeff.
Okay.
Maybe.
Yep, got it. So let me know when you see this.
It's coming up. Yep.
Okay, so this first slide, right? I mean, is basically, this is from another presentation. So I'm going to go ahead and put this on. I'm not going to really cover much on that. I'm going to pencil through here some real quick, right? So
okay. Oh, there we go.
How it's sort of broken down. So we don't have the time here. I just have very generalized results. What you're looking at is % in compliance. Okay.
Oh, okay.
Overall, not % out. So that's one thing. This does follow FDA methods. But so in general, if you look at it, improper holding temperatures, contaminated equipment, those were the two that sort of ranked the lowest. So this did help us, identify and able to prioritize sort of risk factor and then data item points to focus on future efforts, during inspections and things. So here's sort of the overall deli, meat, seafood, produce. You can see here, and then for the data items or the information items, the main ones, and this is overall, right? Not broken out. Our study, we have for every facility type, of course, you've got these information items broken out by facility type as well. And so this is generally, and this is sort of what we found, date marking, food contact surfaces, and some holding temperatures. And so I'll stop there with that. I don't, not terribly surprised,
right?
I'll say, and really not. Our results did differ a bit from the FDA and their latest survey in 2015. But keep in mind, the FDA, their study is basically a nationwide study, right? And so the results are sort of averages across the nation. And this is why I think it's so important for us in state and local jurisdictions to take the time to do this. It is so very important to establish a baseline.
Right.
One of the one thing that stood out to me, a difference, for example, is like in the FDA study with the holding temperatures on cold holding. That I think is where we had a large difference. But I know, for example, in the state of Minnesota, we're one of those jurisdictions or areas that require a mechanical temperature holding, hot and cold. And so the question is, hey, might that as a regulation or requirement and intervention help improve the outcomes? Right, it's testable. So that's one of the things that stood out to me, and where I see the value really in doing this and getting that baseline is and then to kind of consider it against other studies that have been done. And that's where, like Morgan, others have said, I just thought overall for our program, that using the FDA methods first would be very important. And then what we're doing now is pulling data, inspectional data from the same period and going through to see if those using, because we, likewise use sort of that CFP, in, out, NA, NO, to see if the results from that period from routine inspections are very comparable or not, sort of as a validation point first. Because I do agree, I think there's some efficiencies to be gained if you can just refer to inspectional data. It allows you some flexibility, more frequent checks and things like that. But I wanted to check it first, validate it against sort of a special study data. So we're in the process of doing that. And then we'll look to see if in the future, if we just simply move to inspectional data as opposed to the survey. So thanks.
So there is a question, I believe, for you, Jeff, in the chat. it said you did the categories over a single year. Did you do all categories in a year, or did you break them out into, first you focused on schools, then healthcare, et cetera? Sarah, I hope I'm interpreting your question correctly.
Okay, thanks. Actually, in Department of Agriculture, so what we did everything, all facilities at once over a year. But in order to do that, I mean, that was sort of the inventory and how we selected facilities. But we were very careful to just select facilities independently. So in other words, we may go into a grocery store and just pull data from the meat department and not data on our survey sheet and not the others. Just sort of that's sort of how it worked with the facility selection within our inventory. So
and I believe in the guidance document that the link is in the chat, talks about how to do sampling and select your sample size, et cetera. So so Kathy, what did you find surprising or not in your risk factor study? And what year did you conduct it again? You said 2017?
Yes, but we did the years, we did fiscal year 2008, July 1st to June 30th, 2009. Then we did 4 years later, so 2012 and 2013, I think it was, and then 4 years after that. So those were our 3 time periods. And what we found was really interesting, because the first study we did, when we looked back at the results, I should say, because we didn't actually do a study at that point. But when we looked at the results, we only had like 7 inspectors at one point, and we had the highest number of violations of the priority items, or the critical risk factor items. And then in 2012, we had a big outbreak, and we ended up getting a bunch of more staff.
Nice.
And unfortunately, that's why we got the staffing, but we got like 10 more people, and we had the lowest number of violations right after that. So it was interesting. It seemed like the more we went back and the more, they knew we were out there, the less violations we found. And then it did go back up a little again when our staffing level dipped. So it's just interesting to see that, there's so many factors involved, who knows? But other than that, our results were almost exactly what FDA's were. And we had the same thing, the cross-contamination and the cold holding and personal hygiene. But we didn't have as many violations in the personal hygiene category as FDA. So I was wondering if maybe we should be paying more attention to that, because I think a lot of times we miss hand washing, because you really have to stand there and look at people for one time. And, eventually they're not going to wash their hands when they're supposed to. So I just think that's something we needed to focus on a little more.
Okay. Jeff, did you have something else to add?
Yes, I do. And thank you, Elizabeth. To the point about comparability with the FDA, the results, I mean, the methods is important, but to have the same outcome, I don't think we should be terribly concerned if our own studies differ, because we're a particular region or jurisdiction within the country. Regulations and things like that are different. That's why I think it is so important for us to do our own studies and see where there are differences and try to understand why. Is all. So thank you.
I agree. It's just curious to see if we're seeing differences across the region. That's a very good point. So moving on to the next question. And Morgan, I know I'm going to just assume that you probably had some similar results, but could you highlight for us maybe an intervention strategy that you felt was pretty effective, or that you're going to implement if you haven't been able to, to analyze it just yet?
Sure. So really, one of the things that we did is, once we had the data in and we were conducting our analysis of the data, we decided to set a threshold for intervention. The standard doesn't really specify, when you do need to necessarily intervene, or at least they don't give a specific number of outs that would require that. So we decided, if an item that we looked at on our data collection form got more than 30% out in a particular category, we would develop some type of intervention strategy for that. Now, I switched positions shortly after the report was written, so I haven't been super involved in the intervention process, but I know one of the big efforts that we've done is creating hand washing signs, because one of the big issues that we identified was poor personal hygiene. That was really our biggest issue.
Yes.
And one of the ways that we saw that was by using the FDA's data collection form. They have a component for hand washing, which requires data collectors to look at the number of times a staff member washes their hands properly, washes their hands improperly, or doesn't wash their hands when required. So that gave us some information that we could use to both develop those handouts and also to measure the effectiveness of those handouts in reducing the rate of poor hand washing practices.
Oh, nice. That's really interesting. Good deal. So Adam, I think you shared with me some intervention tools. Do you want to share that with the group?
Yeah, well, we looked at the data, and as we dig deeper in it, the prevalence doesn't always correlate to risk. And I think Andre mentioned sometimes the easier things, they're just there, like date marking do rise to the top, or some of the categories that are grouped a little closer together, maybe you see that prevalent just because there's so many data points that get lumped together. So we tried to kind of overlay things with risk. And I think one that we see next that I want to target is bare hand contact, and make sure that that's coming along, as well as employee illness policies, because those are harder to document, as was mentioned with the hand washing as well. And so, but yet have that direct correlation to illnesses. So that's in the future. But currently what we targeted is to try to assess, we have this sense of whether the handouts are effective or not. And we wanted to get some data to help support that, or to change our minds and say that they may be more effective. And maybe we have stumbled across something that has good impact. But we looked at the data and came up with cold holding as probably the single largest direct risk factor violation, and then date marking as well. So we had a handout that we borrowed, a couple of different handouts from different sources, and we attribute those to the creators and appreciate their work. But we wanted to then document how they are implemented. We set guidelines for when they observe a cold holding violation, they give that handout. For date marking, give that handout. And if they see both, then we have a combination handout. And so then we're in the process of collecting that over this time. So we're still haven't completely analyzed the results. We know how many that we've been handing out over time, but then that'll be part of that trending that was mentioned, is in trying to see, is there maybe some case for causality with those handouts showing an improvement, or is there any effect on that? So those are the strategy. That's the intervention strategy that we're using currently, that we're trying to implement and trying to assess.
Okay. So I'll ask this question. It's not on the slide, but you all have these intervention tools. I'm assuming that these would be available on your websites. If people were to go to your state websites, you could find some of these tools. They wouldn't have to reinvent them or something. Is that fair to say? With your posters and whatnot? Good.
Yes, I think, I don't know if you're talking to Adam or.
Yeah, I'm just the whole group, if you have tools to share.
Yeah, so what we did was, one of our intervention strategies was we added hyperlinks to our inspection form that actually sends the operator to a resource library on our website. So like if it's a cold holding violation or a coolant violation, there's handouts that address that. In charts and things like that. And we've actually shared them at a lot of conferences. We've sent them to AFTA. We also did translation documents. So we took all our common handouts and fact sheets, and we translated them into 6 different languages. And so we've shared those with AFTA as well. And then the last thing we did for intervention was we developed a point system. So we have, it's just for internal use, but it just gives us some objectivity and when to go back and that type thing.
Very good. So I mentioned earlier the risk factor guidance document that we have link in the chat, but I have heard FDA, and Andre, you might want to keep me honest here, that they are currently working on developing a risk factor study toolkit, which I think would be extremely helpful. And some of the things you all have mentioned, I think would be advantageous to have in that toolkit. So, Amy, if you want to go to the next slide, there is, I don't know if this is the exact same website that Andre shared, but there is a website there that I think just takes you to the program standards page. But if just to give maybe FDA some advice, what would you like to see in the toolkit that maybe it was lacking when you did your surveys, or you found were helpful to make sure that they do include it? Morgan, do you want to? I'll start with you, Morgan.
Yeah. So I guess one thing that I think would have been helpful, not necessarily for the baseline study, because the baseline study is really it's your starting point.
Right.
But in terms of measuring the effectiveness of your intervention strategies in those future risk factor studies, I think that it would be valuable if the FDA gave a little bit more guidance on the types of statistical tools that can be used to actually measure improvements. So instead of just saying we were at this percent and now we're at this percent, something a little bit more statistically, valid,
I gotcha.
I think would be useful.
Very good. Adam or Jeff or Kathy, just chime in on what you think might be a good tool. Jeff, I'll go with you.
Yeah.
Have you thought about that at all?
Yeah, thank you. I would say for those that are contemplating doing their baseline, I found in particular that the guidance the FDA had published in there was a document, it's back in 2003. I would request that they just take aspects of that and keep that in the tools to the with respect to sample size, and as well for retail facilities. I found that particularly helpful with the inventory in how to select facilities initially, depending on how your data systems are set up and your software and how you license. You may be able to easily identify facilities with your inventory and know how many produce, deli meat, seafood you have, or you may not. You just may have things grouped in by grocery store, if you will, and have multiple departments, but it's all under one establishment, not necessarily broken out very easily. But there was some, I thought, particularly helpful guidance in that document published then, specifically for special considerations for retail facilities and to help jurisdictions navigate that challenge as well. So I thought that was particularly helpful for those for baseline studies, and would hope that could be carried forward in this toolkit.
Very good. Kathy, was there something that you think might be helpful to place in the toolkit? I know that I'll just tell you my experience when I started this, and I'm not an over program anymore, but it took me a while to dig through and find any kind of guidance on the website. So I think a toolkit's going to be very one-stop shop type helpful. So was there something else that you would like to see on there?
So I think, so we were lucky in that we actually hired a Brown University student, an intern, to help us with it. And even though he was in an environmental health program, he was also a statistician. So he was helping us, making sure that we selected the appropriate number of facilities to have a 95% confidence level.
Okay.
So that was super helpful. So, if we could have some of those formulas and things like that, that would be great. And then we were able to do the random selection. That was pretty easy. But you had to know how many to do.
Right.
That was one of the things. And, I actually, speaking of the 2003, I actually looked at the latest one from FDA. I think the risk factor is the FDA report on the occurrence of foodborne illness risk factors, 2013-14. They have some excellent information in that. So building off of that, probably, because in that, they also include stuff about assessing food safety management systems.
Yes.
Which I thought was excellent.
I agree.
You know, if we can incorporate that too, because my thinking was if you're looking at like the violations, you're trying to look and see if those places have certified managers and that type thing. And this helps you do that.
Very good. Yeah, I thought that was interesting piece as well. Adam, do you have any additional tools that you can suggest be included in a toolkit?
I'll try to dream big. So extending on those concepts of having access to a statistician or some of those models that could help you, maybe a behavioral economist to look at help with evaluating your studies, and maybe even in the study design portion, those would be pretty big asks, but maybe a portal to expand on the portal for jurisdictions that are willing to be able to share their studies, and you can learn from those and those kind of things. I think there's a lot of good stuff out there, and I know that a lot of great things will be compiled, and it just for this forum as well as for other forums, just leaning on your colleagues and asking questions. As retail specialists were mentioned as well, just really lean on your network, and as you go through this, once you commit your support group, if you will, accountability partner, whatever, just as you take this on and move ahead with it.
Very good. Well, I'll tell you, I actually learned something today myself, again, being out of the inspection world for a little bit of time, but the mentorship, are those just grassroots formed, or is there some kind of a way to sign up to get onto this mentorship process? I think that's a fantastic tool. How did that work?
Well, I'll jump in. I know that the retail flexible funding model has some of that. So there's some of that. There's been, I think, the NACHO mentorship programs as well. So there's a few different more formal options. I'll throw on my AFCO Retail Food Committee hat for a second and talk about, as was mentioned in the slide at the beginning, about the jurisdictional work groups that we're trying to put together. And I think that this risk factor study concept could be really a big part of that, and trying to pair those groupings that we've sketched out to start with, be able to connect with similar jurisdictions that are taking this on as well. So I think that's going to be a focus for that work group venue also.
So the mentorship was through that you could mentor on any standards. You all just happened to pick standard 9 to mentor on. Is that the NACHO process? Was that y'all's experience through the flexible funding model?
So we applied for it, and as I said, we have a mentor state, but we work on whatever standard they want to work on.
I gotcha.
So they wanted to start with standard 5, so we start with standard 5, but we'll do as much as we can. Okay.
It wasn't just specific for standard 9. They chose these. Okay, that's helpful. Again, helpful. The flexible funding model will support and provide some funding for mentorships and sharing of ideas. So that's really good. So the last but not least for my questions, and again, if anybody has any questions, we're about to wrap it up. You can put them in the chat, or when we finish with the slides, you can raise your hand and we can call on you. But what I'll start with you, Morgan. What is your best advice to an agency that may be hesitant to start this, but in their heads, in their hearts, as you all have mentioned, it's very valuable information and very helpful information to build the baseline and then go forward with interventions. So what would be your best advice to get somebody started and start making these moves?
So I would say first that it sounds a lot more complicated and difficult than it actually is. Again, I think the hardest part is that preliminary stuff and just designing your timeline and figuring out when you want to do it and how you want to make sure that timeline is actually met. But once you get the gears rolling, it flows pretty smoothly. And then also, like you guys have been talking about, like with your having a mentor is super helpful. We didn't have a mentor when we did it, but I know if we did, the difficulties that we would have had would have surely been much less. So if you can find a mentor, get in touch with one of them, and
nice.
It'll make the whole process a lot easier.
Very good. So Jeff, what would be your advice to the attendees?
Oh, very similar to what has been stated is don't feel like you necessarily have to recreate the wheel. If you can reach out to a network and those that may have done the study for materials or experiences, speak, get some insight, some input there initially. There's definitely resources, software, systems like Food Shield, tools and things that are available to help organize, keep things organized, the data, the reporting, the data analysis, things of that nature. So definitely reaching out to entities that have done a study for information, some input, and then just really kind of being thoughtful initially about how, thinking about, just like was mentioned, the special study, et cetera, the time frame, how it'll be collected, the staff training and marking instructions, so you can kind of ensure some uniformity there, and how you would carry that out, and then QA of the data as well before you do a data analysis. So there's some things to think about there, but taking the time to get that in writing so that you can kind of assess afterward as well and just continue to improve the process. But I would agree that's getting over that hump initially, then when you get into it, you're kind of into the flow and it just sort of moves. And so thanks.
Yeah. Kathy, anything additional to share?
Yeah, I was going to say, I agree with what Morgan said, that just get started because it's really not that bad. It looks a lot worse than it is. And the information is really valuable to ask for more staff and things like that. So sometimes it's just confirming what you already know, but at least you have the data and you can use it to your advantage when you're looking for, staffing. The other thing I would say is be really careful about doing any kind of data during COVID, because the data is going to be, you're not going to be able to use that data because,
a little bit different.
Most states were doing, if they were doing any inspections, they were doing them virtually. A lot of staff got activated, so it's just not good data. So we have to figure out a way around that probably.
I gotcha. Yeah, go back or wait a little bit. Yeah.
Yeah.
Adam, what's your advice to the attendees?
Just echo what's been said, is commit to doing it and then find those resources. I think that the peanut butter and jelly videos are hilarious. So if you think about how complex it looks like when you see it written down, you just think about writing down the instructions for peanut butter and jelly sandwich. Maybe I'll take it for granted. It just, using words to describe something takes a lot. So don't let that barrier be there. Use the tools that are out there and connect with your network and rely on the people.
Yeah. So I would think my takeaways, just from my perspective, is you all have mentioned a lot about mentoring. I think that's a fantastic way to start. And somebody had mentioned one other time that they really leaned on their retail food specialists to help encourage, guide, and provide training to, I'll say, standardize or calibrate your inspection team so they all know what they're looking for and how to market. And then that goes along with training, use that retail specialist and then do some training to sending your team out. So I think those are good points for everybody. So we do have a little bit of time for questions. Do you want to go to the next slide, Amy? Sorry. Yeah, so here we are. Questions, concerns, ideas, and future topics ideas for future topics. So does anybody have any questions for Andre or any of the other panelists that maybe we didn't address that you would like to get some additional information for? I don't know, Amy, can they raise their hand or do they just have to put it in the chat?
No, they can raise their hand.
Okay. So I guess we covered just about everything they needed. I'm excited to think that. So
Elizabeth, I'll just, maybe if I could ask Andre one question. I don't mean to put anybody on the spot. I was just curious if there's any sense of with some really exciting thing coming in the data analytics world, and FDA is taking that on with retail data. How do you see maybe the risk factor study concept evolving in light of those progressions?
That's a good question. Adam, I've probably not been here long enough to know that, but I can see, honestly, diving further into a specific area of interest, such as the reason, why is cold holding out? Is it equipment or is it behaviors? That kind of thing. Those are some things that probably I would encourage to consider. So, and
that kind of ties in, Andre, with this whole idea of root cause or environmental antecedents.
Yes.
You just don't say, oh, the food's cold because the food's not in temp because the refrigerator is broken. You want to keep going back as to find out why and how to change that behavior. Mm-hmm.
Yeah, and I know there was a study, an FDA through AFTO funded study of a county in North Carolina that did just that. So that getting that information, making those connections is really important to know who's already done it. Yeah.
So
I'll know more later.
And I'm not that familiar with how the food shield piece is going to work. Maybe at some point we can share how, I know you all have mentioned food shield a time or two for your data entry, and it just kind of, for lack of a better word, spits out the reports. There's not a lot of work that you have to do once you get the data in there. I think that's a very beneficial tool, the whole food shield site that can help you get your data coordinated, I suppose. Jeff, did you have a comment to
yeah, on that, to that end, and I will say we used it. It was very helpful.
Okay.
But there are a couple of reports in there that are kind of under development. And I don't know if there's any comment on that, of when we might anticipate that those would be finalized, because say one of them is Certified Food Protection Manager, that report and testing whether there's association of having CFPM, and is that associated with better outcomes, things of that nature. So I'd be curious to know. I think it's a very, very good tool, has even more potential with some of the reports that are under development in it.
Perfect, thank you. Well, Amy, if you go to the next slide, I think we're about to wrap it up. I just wanted to remind everybody our next call is May 4th. It's going to be talking about HACCP at retail, and we are looking for additional topics. We'll be sending out emails for our future calls when the time comes. And there was something else I know what I was going to say. Something I noticed was, and I might have mentioned this already, most of the risk factor studies are going to be due 22, 23. So a lot of the states that have completed them, hopefully this information will help you get started with your second go round, or maybe your third or fourth go round with the risk factor study. So I hope this was helpful for you all to
Elizabeth,
I was going to let
one thing before we wrap
Steve.
up, as we are wrapping up a few minutes early. I know Amy's going to quick run a little bit of an AFTO conference preview.
Nice, yeah.
And if you want to see the embarrassment of me attempting to sing, you will get to see that on that experience.
You need to stay on.
Yep.
Okay, yeah, I forgot about that. Very good, Steve. I'm glad we had time for that. So this is a little AFTO preview.
We haven't done this forever. Just can't wait to get on the road again. I'm with my friends. I just can't get on the road. Hey, wait a minute. What's that over there? Is that a bridge?
It's a bridge.
Yes, I wanted to see that bridge. And what's that over there? Is that a grain elevator?
It is.
Oh my gosh, we've got to go inspect that one. Right?
Yes.
Yes. So
make sure to bring your non-combustible flashlight.
Yeah, so where are we at right now?
We are in Council Bluffs, Iowa.
Yes, for the first in-person McAFTO. It's the first in-person AFTO affiliate meeting. McAFTO.
Oh my gosh, so we really are on the road again. So we're going to have a great time here, but what happens when we leave here?
Well, then it's time to get on the road. We got to get to Phoenix in June.
What's happening in Phoenix?
Phoenix will be our in-person AFTO conference, which will be June 11th through the 15th in Phoenix, Arizona, or Glendale to be more precise. We are really excited about the conference, and it will be in person.
I am so excited. Yes, so Council Bluffs in February, where it's a bit chilly here, but it will not be chilly in Arizona in June.
No, but we've got to get going. I mean, we've got to be there on, like, what day are we, the conference begin? Like, we've got to get there.
The conference sessions will begin on Saturday morning, so you're going to want to travel on Friday and plan to stay through either Wednesday afternoon or Thursday morning, depending on what sessions you're doing.
Perfect.
Well, I'm already signed up for a workshop on Saturday, and Natalie, you're there with me.
Yes. Oh, it'll be so much fun. How many workshops and what type of workshops are
We
there?
have at least 4 workshops going. So we're going to have a great workshop on labs and samples and how do we make them so that they're usable for regulatory purposes. We're going to be talking about storytelling and how to storytell, particularly for government agencies. We're also going to have a workshop that's focused on how do I, as an inspector, teach active managerial control to my establishments while I'm doing those inspections. And lastly, we're going to have our good friend, Dr. Ben Chapman from North Carolina State, talk about retail HACCP essentially and working with variances in retail establishments.
Oh, I cannot wait for that. So we'll get there on Friday. We'll leave on Saturday after all the workshops are done.
No. Then on Sunday, we get to start with the excitement of the IFPTI Fellowship presentations.
So
the
much
International
fun.
Food Protection Training Institute Fellowship. Natalie, weren't you in a cohort of?
I was in cohort 1. Yes. Oh, such a great experience. And this is the opportunity. This is where they graduate. They have spent the year together and developing their papers. And so this is the opportunity they get to actually talk about what their particular subject that they researched. It's such a great opportunity. So yes, I am excited for that. I've already met some of the people via Zoom. Can't wait to see them in person.
Absolutely, and there are some great presentations. Active managerial control is a frequent topic of presentations. Tribal state relations. There's a presentation I'm looking forward to seeing, which is comparing the violations of restaurants inspected by state or local health inspectors.
So interesting.
Absolutely. There's great presentations. So that'll be all morning on Sunday. What happens at the first-time attendees event?
We have fun.
Yes.
That's right.
So Natalie, Steve, and I will be there to welcome you, our first-time attendees, with so many other AFTO members. This is where you get a chance to network, to meet people from all over the country, and some places from outside of the country. And we're going to make you feel welcome with making sure you have folks that sit by you in meetings, making sure you understand how to move around. And Natalie, social event planner, our Julie McCoy of AFTO,
There's
going to make sure that you don't miss any of the exciting events and you know how to move around AFTO. So I can't wait for that.
It's so much fun, and you get to know so many different people and introduce each other around. It's a great opportunity. I always look forward to that. I love meeting new people.
Sorry, I'm not sure what we're doing here.
Are we lost, Brooke?
No, not yet.
Are we headed to the East Coast rather than the West?
If you give me time, I'll see what I can do.
So is that the sign for Canada?
Get your passports.
We'll let Brooke keep driving. But, in that evening, we start off with with our Sunday night session, our welcome event. And during the opening session, we're going to hear from Natalie about her year as AFTO president.
Yes.
We're also going to hear from someone talking about the importance of state and federal government integration in the Kirkpatrick address. And then we'll be going off into our welcome reception, where we have a great opportunity to meet each other and talk to each other. But after that comes the most important event of the night, which is when we do a fundraiser for the AFTO Endowment Foundation, which it supports important training such as the IFPTI Fellows, last year's cannabis tours that were done on video and now available, first of its type event. All of those sorts of things are supported through the AFTO Endowment Foundation. There's an event that on Sunday night that'll be $25 a head. All the proceeds go to the foundation. And most importantly, what is the theme for the event, Dion?
Natalie and I get to sing, right?
You do. There's going to be live band karaoke. And it's going to have all things Tex-Mex.
I was
So,
we
yes.
were really just warming up for the singing.
We were practicing.
That's right.
You guys hear us sing On the Road Again?
Yes.
Yes.
Maybe a little cool beverage will help out at that event.
So imagine perhaps some of the traditional beverages of the Southwest might come back to be appearance, whether it be some of your favorite beers from south of the border, or we might even have some important margaritas available.
Yes. All right. So after Natalie and I wow the crowd at karaoke, I know there's still more. So the following day.
Oh, Monday is a big day in AFTO. We start out with our colleagues from the U.S. Food and Drug Administration's Office of Regulatory Affairs, including the Associate Commissioners, many of the leaders, and others. Hold it. Are we in Nebraska?
Oh, how did we get here?
I'm sorry, I had to take you.
Oh, there's a dome. What's going on? A train. We must be in Nebraska now.
And more corn.
Right?
Lots of corn.
Lots of corn.
Until there's no corn. Then we'll talk about that later. But, so we do that on, we're very fortunate to have the key leaders from the FDA's field operation, or ORA, with us on Monday morning. From there, we're going to move into food safety culture, learning about all businesses and agencies have one, a food safety culture, once again with Dr. Chapman. And this is going to be a highly interactive session, really exploring the topic of food safety culture. How do we measure it? Where is there not a food safety culture that we would like? There's always a culture, but it could be good or bad. So we'll learn a lot from Dr. Chapman during that session and our colleagues that are participating, including you. Then in the afternoon, we move into 5 different tracks. We have 2 general food tracks going, a retail track, a produce track, and a body art track. And we also have a couple 3 tracks actually coming together that afternoon to focus on innovation and technology within the food industry and in the training sector.
Oh my gosh, Natalie, how do we choose?
Right? We've got to split up and then regroup afterwards and talk about it.
Absolutely.
Okay.
And then Monday night, we are going to have fun. Dion, those golf lessons are going to come to use. We are going to Top Golf, and all of you can join us at this very exciting event. I went practicing a couple weeks ago with a few of our colleagues. I am awful, although I only missed the ball like 6 times, so I'm doing better. But I'll be all ready by the time June comes to have fun at Top Golf with all of you.
That will be so much fun. I've always wanted to do that.
There's a gorilla. Is there a gorilla in Nebraska?
Is it the zoo?
It is the zoo. Oh, okay. I'm very confused for a second there. Ooh.
Okay, but we're supposed to be on our way to BPICS because then on the following day, on Wednesday, we've got to be there for those presentations, Steve.
We have to be there for the presentations on Tuesday. We haven't got to Tuesday yet.
What?
No, we're just getting to Tuesday. Tuesday, we get to talk about the Great Resignation and how do we do the great rehiring? How do we recruit government employees in this challenging time? What things can we do to be innovative to get those employees in the door now? As you know, we have unprecedented number of openings in the government sector. We all have a great need for food inspectors across the country. I know Natalie has a big vacancy right now.
Yes,
so
very interested.
We're all trying. So we're going to learn some tips from some of the best researchers in the country that have done this work, from some of the government think tanks, or excuse me, government examining think tanks, and learn more. From that, we're going to go to an exciting set of discussions from various leaders in food policy from the federal government, from the CDC, the FDA, and USDA FSIS. But more importantly, after they each do a little bit of a presentation, they're going to get together and answer some of our questions. And if you haven't seen this panel discussion, it's worthwhile. It's a pretty interactive discussion that you might catch on your local MSNBC, Fox, or CNN channel on a night. All the same, and they push things back and forth to each other. It's quite worthwhile to see.
So Natalie,
exciting.
There's an elephant.
Yes.
Sorry,
so random.
Squirrel.
All right, so now we've taken care of Tuesday, but can we get to Wednesday, please? Because I've been really looking forward to this session. Natalie.
Yes.
Let me talk about the tracks on Tuesday. Once again, on Tuesday, we have 5 tracks again.
There's more.
Food track, retail food track, produce track, body art track, and cannabis. Now, I do have to note the cannabis track is not fully designed yet. I don't know why that track is always the last one done, but it's not ready yet. Perhaps they've been out on the tour already practicing.
They are a little laid back, but I do expect for it to be phenomenal. So we're going to have a great day on Tuesday night.
Yes.
And Tuesday night, every participant is invited to join us for the Wiley Awards Banquet, where we recognize the finest of the profession, the programs that are doing the best things out there, our best young and up-and-comers in the food safety industry, and all of our leaders across the country. It's a great opportunity. In fact, a few years ago, if I recall correctly, Dion was recognized with the Associate Award, weren't you?
I was, and it's such an honor. So we can't wait to recognize several of you that night. So
That's such a great opportunity to celebrate all the work that people have done in their field. So that's great. Oh, I love that night. It's
Yes.
such an exciting night.
And then we go into Wednesday.
I've been waiting for that
I
day.
know you are. I know what you've been waiting for. Dion's favorite session of this day is going to be We Ain't Afraid of No Ghost, or all about ghost kitchens. So we have a retail track and a body art track, and then a cannabis tour set on Wednesday. The cannabis tour is a full day event and does have a little bit of additional cost to it. Once again, those additional costs just help us ensure that we are able to fill the room, because all of those items have a limited number of attendees, and we don't want to let one of those seats go to waste. So it's like a little bit of a, like I said, a commitment fee. Yes. But we're very excited about all three events. And then, depending on where you're from, if you're on the East Coast, you probably aren't going to be able to get home on Wednesday afternoon. You might have to stay a little extra time, walk across the way to the wonderful entertainment district with over 30 restaurants, bars, and establishments that's just across the way, or the shopping area that's right adjacent also with a large outlet mall. Lots of opportunity to enjoy yourself for a few hours while you're waiting for your airplane. But please join us. And if you are you may have to leave once again on Thursday morning, but it's going to be an awesome time in Phoenix. And you don't have to walk very far outside. They are used to the heat in Phoenix, as they say.
And best of all, we'll be all together again.
Yes.
So how great is it for us to have the entire AFTO family together for the first time in 2 years?
I love it.
To talk about all that we've been through, all the great work that we're doing, and figure out how do we move forward as an organization and help our states and municipalities and our industry folks really thrive in this crazy time. So Natalie, how much longer do we have to drive?
I hope not soon. I'm ready. I'm so ready to be there and
it's
see
FDA
everybody.
approved.
Oh!
Oh, sorry. Once again,
It's a billboard.
we're learning. This is an educational food and drug trip now.
Yeah, but we're going north. So
We are going north.
just someone put in the GPS.
That's no fun, Dion. Oh, so disappointed.
We'll see you there on June 11th. And in the meantime,
Register. Registration is open. Go ahead and get registered. There is an early bird discount.
all right, people, on the road again.
Just can't wait to get on the road
again. And with that fantastic performance, I do want to thank my panelists. Thank you very much. I know it takes a lot out of your day, but we couldn't do it without y'all's experience and input. And I do hope to see everybody that's on this call and the panelists in Phoenix. So thank you all very much. If you have any questions about anything, you can email me. Be sure and stick around for the survey that's going to pop up, and we'll see you. We'll see you on the next call. Thank you. What'd you think, Amy?
I'm letting people log off themselves so they get the survey pop up.
Oh, okay. So we can wait a bit.
Yeah.
Okay. Here they go.
No.
If they logged off early before this ended, they'd still get it, right?
Yep. Yep.
Okay.
All right. Well, it looks like we're going to have these 4 hanging around, but I think it went well. So I'm going to go ahead and end it now.
I'm glad that we got the video in. And we had perfect timing for that. So thank you so much for your help. And my next one is May 4th. So I'll be starting to get geared up for that one pretty quick. Okay.
Okay.
And have you sent, you haven't sent out an invitation yet for that, have you?
I can't help out with that.
You cannot.
No. Hold on. Yeah, no, that's the same day as MedCon. I can't do that one.
Would Daphne?
I think she's gonna be helping with MedCon too.
Okay.
We're all pretty much, is there any way you can move that one? Because we're gonna need all of our people, like all of our webinar people for MedCon.
Let me, yeah, will Steve be doing MedCon too?
Oh, yeah.
Yeah. Let me ask. It may be a little too late since we advertised. I wish you would have noticed that. I might just be on my own, which I could probably do.
Okay.
You know, so let me visit with him to make sure we can still do it on May 4th, because it's just a matter of sharing slides, basically, right?
Yeah.
And you can have the survey pop up again, set it all up for me.
Yeah, I can set it all up and have it ready to go, and you just share the slides.
Okay, we'll talk some more then. But before you send out the invite, we need to confirm that we don't want to switch it.
Okay.
All righty.
Let me know.
Thanks, Amy.
Yep.
Bye-bye.